So this is case of the day, and we're back after Diwali. I hope all of you have had a nice week of vacation. I was away and just got back yesterday, so we're only going to do three cases this week on Tuesday, Wednesday, and Thursday. And today is the 121st case titled "The Challenge of Non-Infectious Granulomatous Disease in a TB Endemic Country." So when I started, I think this was the 13th week, so must have been the 13th case, fourth week in. I had two patients on the same day that I had biopsied, and I showed both of them together. And the second case where we had these necrotic nodules, this turned out to be TB, and the patient has improved clinically and radiologically. But the first patient, and I'll run through the case that I'd shown at the time, was a 23 years old with fever on and off, 10 days history, no weight loss. These were the lesions. Now, so there are nodules, there are areas of consolidation, almost like an organizing pneumonia pattern. So it's a mix like mass like areas and nodules showing necrosis with bilateral thin pleural effusions and lots of lymph nodes with possible subtle necrosis in this left supraclavicular node. Definitely necrosis within the lesions, the lung lesions. And then one way of approaching is to look at the list of multiple lung nodules rather than talking about it as mass like lesions. And so you have infections, tumors, non infective inflammatory conditions, and some miscellaneous ones. And the way to approach these is to try and reach a diagnosis on the CT itself, which in this case was not possible. There was no additional clinical information. And so we straight away went ahead for a CT guided biopsy, which was reported as non-necrotizing granulomatous disease of likely mycobacterial etiology. All microbiology was negative. She was put on anti-TB treatment. There was some initial improvement, but the lesions never regressed. And so we have April, June, and October, and you can see what's been happening. The lesion in the lateral basal segment improved a bit and now has become larger. The two lesions in the right lower lobe became more organized and have regressed with these residual areas, which may eventually turn out to be a CIOP like pattern. Then this lesion in the superior segment of the right lower lobe regressed, but there's a new lesion in the lateral segment of the right middle lobe. Now, the internal mammary node has consistently improved, as have the prevascular nodes, except this one, which has increased in size, and the tracheal space node has increased in size. So we have waxing waning lesions, new lung lesions, and lymph nodes. So I repeated a biopsy, and this has now been reported to be necrotizing granulomatous inflammation of undetermined etiology, and microbiology is negative so far. So let's look at the list again, and we know there's no tumor. ANCAs have been negative twice. IgG4 in the tissue is negative. Serum IgG4 is normal. Patient doesn't have rheumatoid arthritis. This is not amyloid. There's no pneumoconiosis. Histopath twice has ruled out malignancy or any benign tumor. So here's that summary here. So what do we have? Now, there is this 2020 paper that was interesting. It only talked about non-infectious granulomatous disease. It gave a flow chart, and they said if you see a granuloma on biopsy, how do you try and sort it out? And obviously the stuff on the right is not relevant because we're not dealing with micronodules. We're dealing with these macronodules, masses, consolidation. So it's not vasculitis, not lymphomatoid or bronchocentric granulomatosis. So really the only thing by exclusion from the flowchart is necrotizing sarcoid. Now a PET was done 3 days ago, and that's why I'm presenting the case, because I saw it today when I was reading it. And you've got all of these lymph nodes. Plus I've biopsied the patient twice and all of that. So you can see this pattern of reasonably symmetric lymphadenopathy. And, while it's not a classic lambda sign, you could imagine a bit of a lambda here. And so to summarize, lung lesions, nodules, and areas of consolidation, necrotizing granulomatous disease on histopath, and nothing else positive. So let's pause a bit here, think about the possibilities. We know it's not tumor, etc., etc. We've already gone through this. So, what do you think it is? Is this necrotizing sarcoid granulomatosis? Interesting paper in 2022, just kind of puts all of these together and compares GPA with necrotizing sarcoid with sarcoid TB and lung neoplasm. So you can pause the video, you can download the paper eventually, whatever. So the patient's still being worked up, and I will revisit the case after a few months because I think the patient will keep following up with us. And chances are the patient is going to be treated for sarcoid, and then we will know whether there is improvement or not. Plus, I think we'll get the histopath re-reviewed, etc. It just goes to show that it's not like we have all the answers all the time, and sometimes cases just continue. This is real life. This is not textbook where, or appearing for exams where those answers are just there and you have to pick them up. I mean, real life is messy, and so we'll just keep going at it, and maybe 6 months from now I'll present this case again, maybe as case 200 or something like that, and we'll figure out what's going on. My WhatsApp channel, and thank you so much for viewing this.